to be ready, especially for the states and provinces where there has not been any record of someone with the coronavirus. I know most of the hospitals and medical facilities, they have already prepared themselves, of course, expecting that whenever they have any case of the virus, they will be able to know what to do. So I'm just calling us back again to that fact. Even if we have tried to prepare, I want us to go back to the drawing table and take a look at what we have done, and then assume the worst. What is going to be the outcome? What would it look like in the worst case scenario, especially in places where we don't really have all the equipment? Now, are we ready for the very first case of the coronavirus in our facility? I saw some efforts by some hospitals, public and private sectors, trying to put a couple of things in place, and that is really laudable. I encourage you. I celebrate your efforts. I actually also saw someone who was going about sensitizing the public. I saw this gentleman on Facebook who was talking to a pastor who actually had a service that must be on Sunday. He had a congregation gather for service when the government has already said there is a lockdown. Now, I don't want to talk about this group of people because sometimes these things are really annoying. The government should be obeyed. They are not the perfect government back there, of course. We know, but we have to obey the government, especially in cases when what they are telling us to do will be for our own good. There is no rationalization, there is no excuse for anyone making any gatherings this time. If the government says there's a lockdown, then there is a lockdown. There is no justifiable reason why people will dress up and leave their homes at this time when the campaign for stay at home is ongoing, and everywhere children, small kids are singing it like a song. We stay at home, we stay at home. And then people get dressed and go to congregate somewhere. That is completely unacceptable. I can see a whole lot of individuals in Nigeria who are really out to fight for our safety, fight for survival, fight for the people to be okay, fight to help prevent the spread of the virus. And please just stay in your house. We don't want individuals making a rubbish of these efforts. These people, they have volunteered themselves and they are willing to run up and down to sensitize people and help prevent the spread of the virus. Please, the least we can do is to support them from the comfort of our homes. Okay. So having said that, I was talking about the medical facilities again. So are we ready for the very first case? Since we don't have a case yet. Okay, if we have had a case or one or two cases, how did we go about that? How do we rate ourselves? How do we rate our response to the very first case, to the first few cases? Okay, how do we rate our performance? Did we do well? Did we really protect our medical staff? Did we really have enough equipment? Do we have enough medical oxygen, ventilators, and other vital equipment to take care of this? Assuming the worst case scenario and people keep trooping in their hundreds, what's going to happen? We cannot raise a facility and hope that it's just going to be a few people, especially in a place, in a situation where many people really do not understand what we are talking about. Many people do not know what the coronavirus is all about. Many people make a joke of it. Many people think it's not that serious. Some people think they cannot have the coronavirus. I have the statistics from somewhere. I guess there are 50 something deaths in Africa as at 29th of March. This is the record. There are already 51 deaths from Africa. So what does it mean? There is no idea about who is black or who is white or who is from where. If 51 people can die, then anybody can die. Please, we need to just forget about these issues that we're trying to gratify ourselves or trying to assume that it will not, or it cannot, or it may not. However you look at it, I just want everyone to know that this is real. It is happening. People are getting infected and people are dying also. So back to the hospitals and the medical facilities. Do we have enough medical oxygen? Do we have the ventilators? Do we have the vital equipment to take care of it in case we have a whole lot of people infected at the same time? If people are coming in and showing minor symptoms, do we have a section of the medical facility where these people who are complaining about, who are worried about mild symptoms that they are thinking could be coronavirus, but they are not sure? Because we cannot mix up people who are having flu symptoms or who are having any kinds of related symptoms and who are coming to the hospital to try to verify if it is this or not. A lot of people are like this, and we're encouraging everyone to be like this. If you have any signs or symptoms and you feel like you cannot help yourself on your own anymore, we encourage you to go to the hospital. If you think it's a minor flu and you think it goes away within a few hours, then it's okay. But if you think like this is flu and your mind is telling you this is not something you can take care of, you should go to the hospital, especially in this period. Whatever minor symptoms, we encourage you to go to the hospital as soon as possible, because that is how your help can come very quickly. Okay, so how are we separating people who are showing minor signs and symptoms, or who are not even sure, who have not been tested, from people who are already tested and confirmed cases? In the isolation wards, how are we managing the cases? Are they getting adequate attention from professionals? Are there people who are designated to take care of these individuals in case it starts to happen? I'm talking particularly to our people in areas where we have not had any cases at all reported. I'm talking about our readiness to handle the worst cases. Okay, how are we going to know if there are other cases that are going to come from the cases that we are already handling? Once we have a case, someone comes in and we run a test, and this person tests positive, how are we going to be able to follow up with all the people on his contact within his first couple of days that he had this before he got tested? He must have come in contact with a whole lot of people. How are we going to follow up with these people? How do we bring them in for quarantine? Do we just let them be, or do we just announce that they just stay back inside their homes? How do we encourage them, or even make a list, track them, and ensure that they are in self-isolation if we are not bringing them to the hospital or any facilities for quarantine? So are we ready for all of that? Do our health workers have the training and the equipment they need to stay safe while taking care of people who have tested positive to the virus? Do we have this training? The people that have received the training, do they really understand what they were trained to do? Most times we have people who have received training, and at the end of the day, you find them doing something that is not exactly what they are supposed to do. We don't want jokers in this situation. We want people who are really, if you feel like, no, I cannot do this, I don't want to do this, I think it's more appropriate to talk to the people and tell them, I cannot do this. There is no need to go into a kind of service you will not be prepared for and then not take it seriously, because this issue of the coronavirus right now is not something to joke about. Do we have the right measures at the borders, at the crossings, interstates and everything? Do we have any measures to check who is sick and who is not sick? Or are people just moving up and down, both the people who are sick and the people who are not sick? What's going to happen with the public transports? Do our labs have the right, the laboratories, do they have the right chemicals to allow them test for samples? Can they test for samples? Do our hospitals and clinics have the right procedures to prevent and control these infections? Do our people have the right information? Do they even know what the disease looks like, what it feels like? So that when people feel this, they don't think like, okay, they said if you sneeze or if you cough, but there are some other symptoms also that are associated with the virus. Do people know these things? And will they are they sensitized enough to know that they should report to the hospital as soon as they feel any of these symptoms? We have to keep talking. And then the last thing I want to talk about is going to the market. I have a sister of mine who just mentioned that, and also I thought, okay, now we have to talk about these things. Going to the markets and picking up items and dropping them back, this is really not the time for it. Like she said, when we go, especially on fruits and vegetables and items that are not sealed, it is really not okay for us to keep picking up things and dropping them back. Pick these, check. This is not the time to pick and press and toss and turn and then drop and walk away. Please, what you want to buy, check on it, take it and walk away. You keep yourself safe and you keep others safe too. Okay, this is what I want to talk about this evening, and I hope this will go a long way in giving us the information and the push